Today we're going to be talking about Chapter 8, Human Growth and Development. And as we go through, we have to define a number of terms so you understand as we go through what we're talking about. The first term that we're going to look at is growth. And that means the actual physical growth of the body, your height, your weight. It's also the motor sensory adaptation and also the development of our sex organs. So that's the definition of growth. The next thing we're going to talk about is the definition of development and what that is. And that is an increase in our mental, emotional, and social capabilities. So again, when we talk about intellectual ability, that's called cognitive ability. They're also able to, in this development stage, have a variety of expressions of emotion. So again, we laugh, we cry, we pout. It may be any of those. We also need to be able to cope with complex situations. And we have to develop social and interpersonal skills. There's also terminology for human growth and development, and it's physical development, psychosocial development, and cognitive development. So much like we talked about above, physical development is the growth of the body, and again, it includes the sensory adaptations. We're going to be measuring head circumference, chest circumference, height and weight on infants. And on each visit for adults, we're going to measure height and weight. Now, generally with height, we go in and we measure on the first visit. And then we don't measure height again until our patients start to hit about 60, 65 years old. Because that's when we notice when the bones are starting to get less porous, and we may actually see a decrease in height in some of our older patients. The reason that we're going to measure these things is because it can actually give us an indication of a person's health. So let's talk about an adult. An adult who has lost 40 pounds and has not been trying to do that, that could be an indication of a number of things. Maybe one of the biggest things that comes to my mind is cancer. We see a lot of quick weight loss with people who develop cancer. It could be something else. It could be an indication that they don't have a lot of money, or something has happened in their financial world that they can't afford to eat as well as they were. So these are things that we need to be able to identify. In children, we use growth charts. And if you have had a child, you know exactly what I'm talking about. It's all done now in the electronic health record, but it still plots it on a growth chart. We also, if they don't use electronic health records, we actually plot the point by hand on the growth charts. And what it's telling us is where they are on a scale from, are they in the 5% percentile, are they in the 95 percentile? It just depends. There's nothing wrong with being in the 5 percentile, the 50 percentile, or the 95% area, because as long as we're plotting those and they stay in that area, let's say we may just have a tiny baby. They're in the 5% or the percentile. Well, that just means that 95% of the population of babies at their age were larger than them. That's okay. It's fine. As long as the baby is growing and gaining weight, that baby's just going to be little. The same way if it's in the 95 percentile range. We're going to just monitor to make sure it continues. Where we get concerned is if we have a baby, let's say in the 50 percentile range, and all of a sudden we start to see a decrease in weight. And it goes from 50 percentile to 30 percentile to 10% to 5%. That's an issue. That's something we call failure to thrive. And that can be life-threatening in an infant. So it's really important that we look at that piece as we monitor our patients through their lifespan. The second area is psychosocial, and that is actually psychological and social development. So this is our emotions. This is going to be love, hate, fear, anxiety. Those are all emotions. Also our attitudes and other aspects of the things in our minds. Social refers to our individual interactions and relationships with other people in the community. Cognitive development is actually our intellectual processes and includes our thought awareness and the ability to rationally comprehend the world and determine meanings. So we generally are always looking and trying to find more information, and from that information, we usually apply some type of judgment. That's what we do. We're constantly learning and trying to grow. What we have to remember is human needs vary from individual to individual. And they vary as we go through the different stages of their lives. So this is really important to think about, because a 2-year-old or a toddler is not going to expect and react the same way as an adolescent would. So we have to be very aware of this and be making sure we're understanding the different categories of what we're going to be talking about. So, again, we've talked about that. Consider each patient unique. That's incredibly important. Remember, we're not all alike. If we were, this world would be pretty boring. So, first question, if a patient is anxious, which concept of growth and development is being demonstrated? Is it physical, psychosocial, or cognitive? And it is psychosocial. Remember, that's both psychological and social, and that's where emotions come in. And anxiety is certainly an emotion. Okay? So we're going to talk a little bit about the life stages. And the first area that we're going to talk about is Erikson. So what life stages are time frames that study the growth and development. Many of the researchers out there only do children or they do adults. That's the one unique thing about Erikson. He actually includes prenatal to death. And so this is a model that a lot of people will use. Certain changes and needs are characterized in each stage. And as you start working with people and start to live life, you're going to be able to see these and say, wow, that person's really in that stage. I can understand that now. So in 1950, Erik Erikson decided to develop his stages of psychosocial development. He does not normally include the physical aspects. There's conflicts that he has identified in each stage. So with Erikson, it's always something versus something. So if you meet that, if you've been given everything you've needed in that stage, you're going to be able to attain that and move on. If you haven't, there's going to be some type of repercussion and you're not going to be able to get through that stage. Erikson again studied the influence of society and culture on human development. He believed, that psychosocial development occurs as a result of resolving types of conflicts at each stage of our life. Resolving the conflicts allow each person to move through the next level. So he's saying we're we're going to be given certain type of conflicts. If we can work through them and resolve them, we're able to go ahead and move on to the next level. If you fail to complete a level, though, it can cause a delay in their development. Now, it doesn't mean that you can't still complete that. It just means that it's going to take maybe a little bit longer for you to be able to complete that stage. The thing that we have to remember are the transitions are gradual between these stages. These don't just totally go, okay, I am 2 years and 364 days, and tomorrow I'm going to move into this next stage. That is not at all what's going to happen. They are transitions. So some kids may be 2 and 3, some may be 3 or 4. So we have to look at that. To be quite honest, Erikson didn't assign dates to his stages. That was done later by other researchers. He did not earmark these stages by ages. What we have to remember that progress continues again over the lifespan. That makes sense. As we're babies, we don't know much. As we get older, we learn and we learn and we learn more. And then as we start to get to a certain point, we digress. Stress is a huge piece that can cause regression to an earlier stage. And it can actually stop people sometimes from moving through a stage. So stress is a real factor when we talk about the lifespan. And baby boomers, we're going to be talking about that a little bit more towards the end. I'm one of the baby boomers. There was so many of us after the war, and we are going to see that reflected in Erikson. For a long time, there was only one category for adults because they only lived to a certain age. But now we have people living into their hundreds. And so what they did was they went back, they revised adulthood into young old, middle old, and old old. So the first stage that we're going to talk about is called prenatal. And this is from conception to birth. Now, zygote is the term where 2 reproductive cells come together, and that's called the zygote. That zygote has genetic information from the 2 parent cells. So this is where our gender is going to be identified, our eye color, hair and hair type, skin pigment. All of those things are identified through our parents' DNA and genetic information. But there's other things in this stage that are not identified by genetics. And this is things like personality, your intellect, how you're going to deal with family relationships, religion, your beliefs on education, health, and economic status. So those things are things that we're going to pick up from our family, and not necessarily, they are not genetic information we're going to be picking up. So when we talk about the growth of this zygote and then to an embryo, because an embryo is going to be from the 2nd week to the 8th week, what has to happen is, in order for that to grow, it has to receive enough food and, exercise and all that wonderful stuff through the mom to make sure that it's growing. The other thing that needs to happen is, in order to have physical growth in general, mom needs to be eating correctly, should be exercising, and she needs to have good access to health care. They know there's a million studies out there that show that mothers, pregnant mothers or pregnant women who have access to health care have much healthier babies than those women who do not have access to prenatal care. Okay. So what happens is that little zygote comes down, implants in the uterine wall, and that's when the cells divide and it grows and grows and grows. Week 2 through 8 is the embryo. Anything beyond 8 weeks is called the fetus. Now, what we have to also remember is that fetal development and growth is very vulnerable to many environmental factors. We've already talked about food a little bit. If mom is not eating properly, it's going to affect the growth of the baby. But there's also some other things like smoking, drugs, alcohol, even over-the-counter drugs. When you get pregnant, there's a very, very short list of medications that you're allowed to take because it can actually hurt fetal development. And so all of these things can be harmful to the baby. And so what happens is, especially in smoking moms, we see something called an SGA, which stands for small for gestational aged baby. It's almost like their growth has been stunted. They're going to be much smaller and have a little bit more problems than someone who has not had any of those environmental factors that are out there. But smoking's a big one to get SGAs. Now, we also have LGAs, which are large for gestational age babies, and we see that when the mom develops gestational diabetes. And she picks up a lot of weight, and the baby's going to pick up a lot of weight as well. So that's a little bit of a problem. In this, again, we get rapid growth, we hope. That's what our goal is. And this is prenatal. We don't have any psychosocial stage with this whatsoever. On page 190 in your book, or table 8-2 in the ebook, it shows you prenatal development and what happens during each stage. And it's just kind of interesting. I always love to see fetal development. So much can happen during these different development stages in the pregnancy. The next category we're going to be talking about is infancy. And this is anything from birth to a year. Now, neonates are usually 0 to 30 days. That's what they consider a neonate. But we're going to talk about this category from birth to 1 year. Okay? There is tremendous growth in this area, in this stage. And we know that the babies usually triple their weight in their first year. They usually gain multiple inches over the first year. At about 8 to 12 months, they get teeth. Their muscular and nervous system are developing very, very quickly. When we look at movement, the first movement in babies is really reflex. It's a reflex. So if they think something's coming out towards them, they're going to be startled. But they soon learn how to control that. So they learn how to lift their head, they can focus their eyes, they can roll over, and then a lot of times before the end of year 1, they've gone on to learn how to crawl or to walk. Cognitively, they vocalize, and babies usually learn, that small infants, they learn by imitating the noises that they hear. And so you'll hear babies coo, or it's funny because right now I have a 3-month-old little grandson, and we'll talk to him, and his mother will go, hi, and I swear it sounds like he's saying hi. But it's funny, he's talking and he's laughing. It's really interesting to see day by day what they learn. They learn how to also manipulate objects. So think about that. As they're born, they're real clumsy. They can't really put anything in their mouth, but as they grow, they're able to get coordination of their hands, and then everything goes into their mouth. One thing that they have found is babies must receive adequate tactile stimulation. That means touching, snuggling, holding, those type of things. There's actually studies that have been done that show babies who do not have that physical touch actually die because that's so necessary to them. I don't know how you couldn't just snuggle a baby. I just want to hold them all the time. In this stage, Erikson calls this trust versus mistrust. So as we look at that, babies are going to be dependent on others for physical and emotional survival. And for those who have loving parents and caregivers, they're going to be able to very quickly gain trust in those people. But those people who don't have that, they have parents that maybe aren't attentive. They may be drug addicts. They may, there could be a number of reasons that they're just not attentive. That's going to lead to mistrust for that baby, and it's difficult for them to get through this stage. The toddler is the next level that we're going to talk about. This is age 1 to 3. And in this stage, we still see that little protruding belly. It's so cute. I think babies always have such a big belly. If you look at them when they're born, they've got this big old head that they haven't grown into yet, and they got this big old belly. Well, their head, they're starting to grow into because their body now is getting to be the same size as their head proportionally. But they still got that big old protruding belly. By this time, they can have up to 20 teeth by the age of 3. And female babies or toddlers usually have control of bowels and bladder. It takes longer for boys, believe it or not. Their motor sensory is increasing. They're now able to run, jump, and climb all over everything. This is the stage where parents really start to have difficulties because they are constantly getting into things, investigating and searching for new things. They're going to try to climb on the top of the dresser to see what's up there. It makes parents crazy, but this is really necessary. This is part of their development. This is where childproofing kind of comes in. Excuse me. So this is when, if you've got a pool, you're going to, put gates up. You're going to make sure you have baby locks on cabinets, drawers, those kind of things. Pick up the breakables, anything that they can really hurt them on. Use the plug covers so they're not sticking something inside of the electric socket. So again, it just is things to protect the child as they are learning new things and to investigate and to be just searching out for those new experiences. Cognitive skills are developing very quickly. They're learning languages and being able to put things into sentences. They learn ideas, attitudes, and values at this stage. But the thing that's important to remember is while they're learning all this, they still believe that their opinion is the only opinion that's correct. So you can try to say, no, don't do it that way, do it this way. And that's when they throw themselves on the ground and have a temper tantrum because they think they're doing something right. So that's when we start to see that temper develop and the temper tantrum come out. In this category or this stage is autonomy versus shame and doubt. If that toddler develops confidence and begins to kind of start to take care of themselves and actually receives encouragement to explore and learn things like getting dressed, just helping. Can you get your shirt on or can you take your shirt off? How about feeding? Let them, yes, they're going to be an absolute mess. They're going to have food, but they have to be able to learn to become independent. Again, using the potty is one of those things. If they don't, so parents who encourage that inquisitiveness and they encourage that independence, that toddler is going to be very autonomous. But parents that are overprotective and don't want anything to happen to to their babies, they can actually have very unrealistic expectations for that child. And they may actually develop a sense of doubt and shame. And that is when that child feels totally inadequate. And I'm sure you've seen this sometimes, even in kids. The one thing I want to say, it is fascinating to watch a child grow and how fast they learn. It just boggles my mind that our bodies are so amazing that a child can go from, in a year, they can go to saying, words and walking and crawling and laughing and crying. And it's just amazing to watch the progression as they go through that infancy stage to the toddler stage and then on into the preschool stage. So in the preschool stage, this is age 3 to 6, and this is when they start to become taller and thinner. This is kind of when they thin out. That big old belly that they had as a toddler has gone away, and they're thinning out. They are definitely increasing their self-care. They can now get dressed by themselves. Their sense of balance is improved. Now they can skip, jump, and skate. They're speaking much better than they were before in full sentences. They are developing an awareness of others at this stage, but they still think everyone thinks just like they do. So a lot of times we see this little 5-year-old and we go, why can't they comprehend that that's not right? It's just that they're not there cognitively yet. Okay? They have a short attention span, but they are able to do things like the alphabet, recite the numbers, learn their address, phone number, those type of things. In this stage, this is called initiative versus guilt. And that is, if they have initiative, they're going to be building on the confidence they learned as a toddler. And then they're going to start to initiate their own learning and seek out new experiences. This is really interesting to watch children play, because you'll have some kids that just, will have such an imagination and they just constantly are saying more and doing more. And it's really interesting to watch that as it goes. So when we look at the parent, if they are restricting this growth and criticize and scold them and yell at them, that child's going to develop a sense of guilt. And this guilt is going to turn into, will decrease their natural enthusiasm, and they'll be very hesitant to take on new challenges. School-age children are going to be from age 6 to 12. And again, we know growth is continuing. They keep getting taller and taller. The growth is much more pronounced between age 10 and 12 when most school-age children are hitting puberty. So we see the body start to change, the breasts starting to develop, the hair on boys and their voice lowering and those kind of things. Their permanent teeth start coming in. They have a much better motor sensory. That's much more increased. They now actually have some grace and agility. They can help with household chores. So it may not be huge things, but they could certainly help with emptying trash cans, setting the table, those type of things. They should be having increased responsibility. With their cognitive development, we're going to see more logical thinking. And they can start now seeing things from different perspectives. So this doesn't happen till about 6 to 12 years old. So those of you with those toddlers and preschool ages, hang in there. They will start to see things from a different point of view. They have an increased attention span, and they are very proud of their accomplishments. They can reason and problem solve. They learn to follow rules, and they are learning to develop a sense of morality. what's right and what's wrong. In this category, or in this stage, Erikson calls this industry versus inferiority. So kids, those people that are industrious, those kids that are industrious, they get pleasure from experiences and completing projects, and really are excited and anticipate that recognition and acknowledgement. They prefer their friends to family, and they are very much influenced by their peers in this stage. If this group of children are not accepted by their peers, and they can't meet their family's expectations, and that's a big one, they are going to develop that sense of inferiority and a decreased sense of worth. The next stage is adolescent, and that's between the ages of 12 and 20. And remember, Erikson didn't put these numbers on, somebody else did. Again, with adolescence, we're seeing dramatic physical changes, mostly due to the reproductive system. They're growing, they have hormones raging, all those wonderful things. Their fine motor skills are increasing, but, those gross motor skills still aren't great. You still might see them trip and be a little klutzy. We see in this stage where they get tired very easily after an activity, and they either want to rest or sleep a lot. This is very normal for this age group. They have a big increase in their cognitive ability. They are acquiring large amounts of knowledge and are able to reason. Think about college, high school years, college. These people are getting, the children are getting a lot of information all at once, and they're learning it. It's not a problem. At this age, they're starting to develop their own philosophy of life and kind of looking at what their future occupation might be. The one big thing with this stage is they are very prone to stress. Because remember, they're trying to please a lot of different people at this stage. So Erikson called this identity versus role confusion. So they're very interested in their body changes, but they're also confused about who they are. And that's where that identity piece comes in. Who am I? What am I going to do? What's going on? They're going to have mood swings, especially if you have a girl. You're going to see these huge mood swings. And that's hormonal changes going on in their body. They're going to try on different roles. They're going to see, okay, maybe if I'm good, let me see what happens. Maybe if I'm really bad, let me see what happens. And this is where their rebelliousness comes out. They're trying to search for that identity as they work through who they are and what they're going to become. And this is really important to remember as we're raising our children and as we're working with people at this age. They are very critical of their parents, and they absolutely resent any advice we could give them because we are dumb. And their peers really still have a huge influence on them. If they can't determine their identity, so if they go through this and they go through the process and they're not allowed to figure out who they are or what they want to be, they're going to lack a sense of identity, and they are going to have major role confusion in their life. So, question number 2. Which of the following stages does a toddler fall within, according to Erik Erikson's stage of psychosocial development? So, toddler. Is that autonomy versus shame, trust versus mistrust, or initiative versus guilt? Just a hint, that's the type of question that will be on your test. Okay? And it is autonomy versus shame. Okay? It tells you the other areas as well. We then jump into young adulthood. And remember, we started talking about this a bit ago, as we get into as we get into the other adulthoods, the old and the old olds and all those wonderful things. You know, with the change of longevity and and living much longer due to, you know, technology and the things, to be able to treat diseases, they consider 20 to 30s young adulthood. And with that, we're going to be seeing physical changes again. We continue to grow. The sad thing is we peak at around 30. That's the best we're going to be. So if you're 30 right now, you need to be celebrating. Because once we hit 30 and we start on that downhill slope, we're going to start, our skin starts losing moisture, our GI secretions decrease. We have a much more tendency to increase weight gain at that point. Again, our motor sensory peaks between 20 and 30, and it starts to decline after we hit that 30-year-old mark. Our hearing and vision starts to decline after 30. Yeah, it's just heck getting old, I'm telling you. At this point, at this stage, this is optimal cognitive functioning. This is the best you are ever going to be in learning with your cognitive ability. This category is called intimacy versus isolation. And with this category, or with this stage, the task is to transition from being dependent on somebody to being responsible. To be able to make commitments, to establish themselves in society. So, when we look at the responsibilities in this category, it's developing and forming intimate relationships, raising, having babies and raising children, obtaining advanced degrees, and establishing your career. This is like a lot to do within a 10-year period of time. If you do not work through this stage and you don't develop those responsibilities, you have a fear of making commitments, and it can result in isolation or loneliness. And there's people out there that you can see that really have a fear of commitment. They haven't been able to work through all of these, all of the things in the stages. We then jump to middle adulthood, and this is going to be between 40 and 65 years old. And my gosh, if we thought we were sliding down the hill before, physically we are declining, our bone mass is decreasing, our muscle mass is decreasing, endurance, physical strength, all of that's going out the window. This is when we start getting wrinkles because our skin again has lost that moisture, and we start to see that. This is where our body systems start to decline. We start to see decreased functioning of our body systems. We are concerned about our health. We start feeling that concern. And this is the stage we're going to start seeing chronic diseases appear. Motor sensories decreased, reflexes decreased, balance and coordinations decreased, and again, our hearing and our vision decreases. But the good news is that our cognitive ability is still strong, and this is when our creativity increases. So there's hope there. We get to become more creative between age 40 and 65. This stage is called the generativity versus stagnation. Generativity, I didn't say that right, but anyway. And this is when we are shifting our concerns from ourself to the next generation. And I can tell you, when I was reading this and, fixing up my notes, I thought, oh my God, that is me. We have increased involvement with our friends in the community. We evaluate if we've met our goals. This is when the midlife crisis hits for some people. because they realize, oh my gosh, I haven't gotten to do everything I wanted to do. So now I'm going to try to go back into that 20 to 30 and see where I can get. If a person is not able to establish their worth or recognize the contributions that they've made, stagnation can occur in this stage. That can then result in self-absorption and being absolutely obsessed about their health. And the last stage that we're going to talk about is late adulthood. This is where we have the young old, the middle old, and the old. I love that. So you're young old if you're 65 to 74. You're middle old if you're 75 to 84. And you're old if you're 85 or above. So we're going to talk about the category generally, and then we're going to talk about those different 8 stages we just talked about. So this again, remember, physically we're declining. Our cardiac, renal, and immune systems are decreased. So we have to remember that. This is why right now it's so important with this coronavirus that we're keeping people who have immune compromised or their immune systems are not working as well, to keep them away from this so they don't get exposed and contract the coronavirus. We have a decrease in our peripheral circulation, and that equates to not being able to tolerate heat and cold as well as we used to. Our motor sensories decreased. Again, our vision and auditory and physical responses are decreased. This category is called ego integrity versus despair. And in this category, this is when major things are happening with them. There's retirement. It could be a loss of a spouse or a friend, a new family role. Maybe you are a grandparent for the first time, or an increased concern about your health. So all of these things are floating around in this stage of life. As people face mortality and they review their life events, if they are successful, they are going to have a sense of that ego integrity, which is going to be, they're happy with where they are. They've looked at their successes and their failures. You know what? I had some failures, but I learned from them. So overall, I'm really comfortable with where I am. They're going to be great at that category of ego integrity. But if they evaluate their life and they feel like they're a failure and they haven't done what they wanted to do, they're going to be very sad and can fall into despair, which is really sad when we look at that. So I want to go back to these categories because I have a really hard time. I have seen really old 65-year-olds and really young 85-year-olds. So when you sit there and say that 65-year-old is a young old, it is absolutely according to each patient. My dad, when my mom was 83, my dad was 85 when my mom died. He moved into a retirement village and he found this wonderful woman. It was his girlfriend. They actually lived together. And I was pleased as punch because he was so happy. This little lady they dated until he died. But at 90 years old, she was kayaking in the Cuyahoga River. Now, she was a spitfire of a little thing. But I'm going to tell you, she was an old, but she was anything but frail. And then I've seen those 65-year-olds, they're afraid to do anything. They're afraid to go out. They're afraid to do anything. And so they really are more frail than some of the other ones. So please evaluate your patients. Make sure you're not pigeonholing them in a category just because of their age. Okay? Again, your book kind of talks about that a little bit, and it goes back into the baby boomers. I mean, there are many, many baby boomers right now. That's where our increased geriatric population is coming from. And the one thing is, these baby boomers, we're not quiet people. We're going to go like gangbusters. When we retire, we're going to be excited about it. We are not done. We are going to work at making everything better. We're going to get involved in community service and nonprofits, and volunteering and those type of things. So that's something that you're going to see with the baby boomer generation right now. And again, it talks about don't rely on the age as the only assessment for your patient, because you're going to be very misled. Okay. The one thing when we talk about care considerations for every level, again, don't assume. We evaluate everybody independently. Don't stereotype. And the one thing is, every stage is different, but every single one of those stages need respect, compassion, and empathy. And that's very, very important that we remember that. Okay? And the last question in this one is, which of the following age groups would include care consideration of giving explanations along with a rationale? Would that be a toddler, a preschool, or adolescent? So giving an explanation as along with the rationale of why we're doing something. And the right answer is adolescents. Toddlers and preschools are not cognitively ready for that, but adolescents are. And they're starting to not, care about adults. So we just need to explain what we're doing and give them a rationale of what we're doing as well. And that's it for Chapter 8, Part 1.